Senate Health and Welfare Committee.
I too want to thank all of you for being here. This is democracy in action, and this is how the political will to make some change is created in Vermont. It's by people at the grassroots level, at the forums, all of you willing to come here, take your time off to be part of this discussion. And you got our attention. I think that's pretty clear. So I thank you very much for that. That's how it's going to happen. And I talked to a lot of people. I participated in the forums as well. And it's really, really obvious to me, as it is to all of you, that despite our best efforts, the system is indeed broken. And some of the numbers are displayed up here on the signs that people are holding. There's still uninsured Vermonters. There are a lot of underinsured Vermonters. There are a lot of underinsured Vermonters who don't even know it yet because they haven't had to take advantage or to use their health care plans. And then they find out that their plans aren't as good as they thought they were. And those folks are out there, and we're hearing from a lot of them. We also know that costs are bankrupting this system. When we look at the budget problems we're facing in this building, a lot of it's caused by rising health care costs. And when we look at what's happening nationally, we're up to 16, 18% gross national product in healthcare costs, and we have got to do something to change that system because it is not working for Vermonters. It's not working for Americans at all. We are committed. And the commitment that my committee and Steve Meyer's committee have made is we're going to move this discussion forward. We're going to stop talking about whether it's a good idea or a bad idea. We're going to start talking about what the questions are, what the concerns are. We're going to answer those questions, and we're going to try to design a system which will get us to our goal of universal coverage of all Vermonters at an affordable cost. It's not that complicated.
Yes.
I've heard the word partners. I look at all of you as partners in this discussion, not only to talk to your friends and neighbors, to deliver the postcards, which are pretty powerful and compelling, but also to help us work through the details of how this system would operate and how we go to Washington and ask our congressional delegation and ask our president to give us the waivers that we need. Let's start talking about what a better system would look like. You know, we can do it here in Vermont. Vermont's shown the way on a lot of different issues. And I think we can show a way on health care, that there is a better way. And the federal government's going to look at us and say, hey, those guys have got a good idea. Maybe we should look at how they did it, and maybe we should do this for the whole country. We can do it. This year, and we're going to make progress this year. We can get there in Vermont. Now, I hope we'll see all of you next Tuesday evening. Our two committees, Steve's committee and my committee, are having a public hearing, and I want to thank James Haslam. Where do you go? Right here. I sat in his office, and he said, how about a public hearing really early on in the legislative session? And I didn't say yes immediately, but I said yes because I realized it's a good idea. People need to be heard. And after sitting in the forum, I recognize that people have stories to tell, and we need to hear them. And that's the starting point for a longer discussion. So thank you again for being here, and let's see what we can do in Vermont.
Thank you all very much. This is really exciting. We're very excited about 2010. As Doug mentioned, and there's going to be big hearings next Tuesday, the 12th. We're coordinating transportation around the state, trying to help bring people here. We want to fill this building. If you're not involved in a local organizing committee, there's county-based organizing committees.